Okay, hello everyone. Welcome to today's webinar on Healthcare Transformation Initiative, the first of its kind collaborative effort focused on business continuity, resiliency, and risk, and leveraging common data in a shared cost model. I am Gabrielle, your host and moderator for today. Today's presenter will be Graham Dykes, Managing Director and Board Chair. Before getting started with the webinar, let me go over the housekeeping rules. Some housekeeping rules. These presentation slides will be sent after the meeting. Please type your questions as they come up in the chat panel located in the right-hand side, and we'll have time for Q&A at the end. If we don't answer all of your questions today, we'll reach out and answer them by the close of business. Don't forget to download our annual Event Watch Report at resilienc.com/eventwatchreport. If you have further questions from today's presentation, please reach out to Graham directly at graham.dykes@resilienc.com. Now I'll hand it over to Graham Dykes, Managing Director, Board Chair.
Good morning, everyone, or good afternoon, everyone, wherever you may be in the world today. Excited to be here to share with you what we are doing within this initiative and within healthcare in general. And I'm hoping this is going to stimulate a lot of questions, so I will try to leave as much time for that as possible. As Gabrielle said, my name is Graham Dykes. I have been in technology for 25 plus years, and primarily in serving in software as a service, cloud-based delivery, and data as a service, or data delivery. And very happy to be working on this together with Resilinc. So if you are a provider of services to patients, a hospital scenario, or if you are a distributor or a GPO, or in fact a manufacturer or supplier, this is for you. We are not targeted specifically for any one particular group within the whole value chain. But what I do know, and what you're looking at here, is that since Hurricane Maria, it really stopped the market or stopped the industry in its tracks. And there was news that there was going to be little damage, no supply shortage, or somewhere in between. The truth was very hard to discern. And along the value chain, of course, the providers end up being the last ones to hear about these events. Well, as we all know, that sparked a very expensive and very costly and delayed a lot of patient care at the time. But fast forward from there, we tend to lose our memory very quickly, and we've had the different hurricane seasons. We've had a lot of M&A activity. We've had a lot of shortages, lots of recalls. We've had factories blow up in China. We've had a series of events that are cause for concern to our supply chain. And if you notice on the left-hand side here, the events that are happening over time in this industry are increasing. 2017 is the green and 18 is the blue line. So you can start to see across the board issues that affect supply chain are on the increase and have been for some time. And what we also know is that as you start to geocode this, which we can do over about 9 years of history, we can start to overlay where all these events are happening and the concentrations of risk, whether it's from power outages, as I said, or factory fires or M&A, whatever they are, we're able to start to see these trends and where they're occurring. So more and more is happening each day that we do business. What I also know from talking with a lot of hospitals and provider networks is that visibility still lacks. In fact, it lacks in the entire value chain. A lot of suppliers don't have knowledge of their second tier. Hospitals don't have knowledge generally of where things are manufactured that they buy, whether it's a syringe or a stent or an orthopedic implant kit. There's very little visibility into how all the supply chain is connected and interconnected. which is the key thing. So being able to analyze where the failure points are, as opposed to just doing business with one manufacturer, having the visibility to know where that manufacturer is making the goods they supply to you, and having an early warning detection. I am clicking, but nothing's happening. Okay, so the third problem that I encountered was where the data assets live. Where are they within the organization? And so what you typically find is that we know from an ERP system or from my clinical systems or something in between or an item master that we may extract from a GPO, we do have some good insights, of course, into the tier ones as who are you buying data product from, but not necessarily where it's manufactured. So what we're doing is really starting to understand and do a lot of research on the events like I described and on the research data. And then also providing third-party data in towards where a product is manufactured, whether that be financial scores from Rapid Ratings or Dun & Bradstreet, and then et cetera. And then the actual manufacturer or supplier's data that they do provide onto the platform. So the problem is that all this information that's needed for a resilient supply chain to satisfy the business continuity demands of the boards at the manufacturers and all over requires a disparate set of data, and it has to be contextually analyzed and brought to bear at one time. That creates a problem. So what have we learned through 9 years of doing business? We've learned that data is central to the risk problem. In fact, managing your risk in your supply chain is a data problem. Not having the data in a timely, accurate, and verified and validated manner. So that's what I'll get to what we're trying to solve. But being able to bring a large swath of data, for instance, do you know what my supply chain is, or do you have a good idea what my supply chain is? Have you, in fact, mapped a supply chain of other like-minded companies? Can I visualize this data in 3D and visualize it in contextually so I can know what sites that could be affected in my supply chain against what events, and being able to understand what patient care is at risk or what revenue is at risk in a matter of seconds. And then also being able to understand the flow of data. Where did this come from? Was the API manufactured here, and then it got placed into a compound here, and then assembled or transported and packaged, and then shipped to a port, and then it came to me? What was that flow? And very important to know if there's a disruption, where in the flow is there that disruption? Being able to do workflows to enable you to do mitigation, find an alternate source, or contact vendor to understand what the potential impact is, of course. And then being able to benchmark against your peers of your supply chain, big benchmark suppliers, benchmark peers, and benchmark against other industries. Very important. So we also know that from there were some Sterigenics issues fairly recently, and we got a lot of phone calls about that. Did you know about it? Is the first phone call we get. And we had been sending our customers since September 2018 information about Sterigenics and what has been happening in the public domain, whether it was a lawsuit followed by the actual shutdown of the facility, and then the FDA shortages that occurred. Not the FDA, but the FDA stating all the shortages. All right. So the ultimate idea of that is not only to be able to understand what's going on and get early warning, but then being able to elegantly manage through that crisis is very important. And then being able to extract that data and use it proactively to understand where the benchmarks are and or what could be the impact to my organization as a result of this data. So getting to the HTI portion now, the healthcare transparency. We've been in business with high tech and others for quite some time. And we have received upwards of, let's say, the number is about 20,000 surveys from the high-tech supply chain, business continuity plans, supply chain visualizations, ISO standards, quality standards, could be CSR information, women in leadership, diversity, inclusion, cyber. So we've received in the high-tech industry a tremendous amount of data and transparency data, visibility data. And I noticed that it was lagging in healthcare. And healthcare is an industry where we today, believe it or not, have about 4,000 surveys. So it's pretty substantial, but it's not to the level of visibility as other industries are. So I started asking the questions. Why is vital information so slow to providers? It takes weeks, sometimes months. Why is the cost measured in billions? So through disruptions every year, I mean, billions and billions of redundant effort is spent because there's no data standard, there's no communication standards, information is slow coming, and people protect it. And there's delays in patient care occurring way too fast. One study had 69% of hospitals had delayed patient care due to supply chain originated issues. So that coupled with some digital literacy issues in some hospitals, lack of resource in the hospitals, people have large inventories, very high inventories compared to other markets, and they have no standards like automotive does. So I created the healthcare transparency with that in mind. And my idea was to say, it is so complex, healthcare. The supply chain is incredibly complex. And you have these GPOs and distributors in the middle, which creates a lot of value, but at the same time also adds another layer of potential communication, miscommunication. So I wanted to create a network approach to the problem, a shared cost approach, instead of making this data, should I say, available to as many as possible, lowering the cost so I can make it available to all stakeholders. And I do that by having the data reside once in the centralized database and then sharing it, much like master data management, but having the ability to share this data confidentially and with whom I choose within the network, within the ecosystem. That is a foundational concept. Very few systems can do that. And this is the foundation of what we've embarked on. I want to unite the industry. So if there is a disruption, I want the manufacturer and the provider and the GPOs and the distributors to work together on actually resolving the issue. In some instances, people are washing their hands and just distancing themselves, and that doesn't help our patients, the mission of the patient. And then we want to provide actionable insights and make this integratable data. So you could take it back inside to your clinical systems, into your ERPs, and do the work that you need to from there. So the opportunity here for change exists and is changing fairly quickly. Focused on the ecosystem, engaging the whole industry, and making it affordable for all. Those are the key pillars of the HTI. So in the sub-tier of data or in the supply information, if there's disruption anywhere, GPO, distributor, data flowing this way was very slow, and we've changed that now. So we are providing to the hospital and hospital systems the information about disruptions, and we are pushing it. The providers are now pushing back along the value chain to say, or pushing back upstream to say, I've heard this is happening. Am I affected? Or actually, I know I'm affected because I have these products going through the Sterigenics process. You can engage the process of mitigation within seconds, as opposed to literally waiting weeks and putting teams on it to understand impact. So this is what we're doing, and this is going to increase the visibility and transparency of data, speed the velocity of data, give you dependable, consistent information. So data, if there's a problem here, they could receive the same data that they're going to receive. Everyone's going to have the same information. So we're working off the same information all the way through a crisis in this case. we do have, of course, the proactive and the risk management side. So what's my goal? Reduce patient care delays, this is the mission, and eliminate $1 billion and make it affordable. So there's a key mission component to HTI of what we're trying to accommodate. So I created a board of directors, and it has Ed Hiscock, who's the, this is actually wrong now, he's actually the Senior Vice President of Supply Chain for Trinity. He was promoted recently. Charlie Maselli, same position at the University of Vermont Health Network. Craig Fix, formerly of Dentsply. So this is on the provider side, and this is on the supplier side, the manufacturer side. And Kevin Nelson, who's the Chief Purchasing Officer and SVP of Becton Dickinson. Of course, Bindya Vakil, who is our CEO, and Fred Krantz. I am working with all GPOs and distributors as we speak, and we'll be announcing some board positions that I will allocate in the near term. So what is the board trying to do? The board is trying to help set the standard, set the visibility of data upstream, downstream, and help direct us in where we should appropriate any funds and how we can appropriate the funds to help the entire industry, as well as helping my individual provider network or my individual manufacturing operations. So it has a dual component there, which is very exciting. What have we done today? We are very young, but I'm pleased to say that we do have momentum. We are not, we don't have mass yet, but we have momentum. We have about 4,300 suppliers that have completed surveys in healthcare today in our system. So that means that 4,300 suppliers, manufacturers, have gone into our system and entered data. That's a pretty substantial number. We have about 1,500 what we call visualization, where we're asking, where are your products manufactured, and are there alternate sites, and what's the downtime, what's the uptime or recovery time for these. And then we're also doing business continuity plans. We have about 3,000 of those. So very exciting. We have about 30 members in the HTI, covering about 1.4 trillion in market cap, which is, again, very exciting. I told you a couple earlier. We have Boston Children's, we have Dartmouth Hitchcock, we have Baycare, we have Atrium Health, and then on the more manufacturer side, we've got a nice mix of biotech, pharma, and life science, from Biogen to Shire to Boston Scientific to Amgen to Johnson & Johnson. These are the clients who are monitoring their own supply chains very diligently to the multi-tier, as well as participating in this, because everyone understands that providers want more and more resiliency and business continuity data in their RFPs. And that is becoming very standard. And that's why the manufacturers are joining, because they want to understand what is being asked and how they can get ahead of that, and how they can make sure that they are collaborating in the partnership, in the, what's the right word, in the spirit of the partnership, to provide the hospitals what they need in order for them to run their business. The other side, we have about 12%. Interesting notes from our event watch, which Gabrielle said you could download. 12% of 12,500 sites actually have an alternate. So that's pretty scary, right? That's a very, very large number. And so what that means is that there is a lot of risk that lives, and these can be worked together in tandem with your suppliers to better. And in our healthcare system, as I said, we've got about 4,000 suppliers, about 220,000 parts, although that will go to several million soon. Parts meaning products or piece parts, components of a part. We have about 75, actually, I think that's over 85,000 sub-tier sites now, sites mapped in our system. About 9,000 tier 1 sites. 115 countries are mapped. And this is the really, really exciting thing. This is now up considerably. It seems like a small number, but we have HTI generated phone collaboration with the manufacturers to discuss the level of transparency and visibility that they want. And in some instances, the manufacturer was a user of our tool and the provider was a user of our tool, and that was a 10-minute conversation because they know the rigor that Resilinc is applying to ensure resiliency in the supply chain. And that for the provider was very comforting. And we could validate and verify the benchmark rating of that manufacturer to say they're best in class or they're not, and be able to say they have second or third tier visibility, that they're ongoing monitoring. Gives the provider tremendous comfort. And then on the other side, the collaborations are starting to occur where people are sort of asking about, where are you manufacturing? I've got such a high concentration of risk in Thailand, let's say. And how do I manage through that? Do you have an alternate source? Should we be spreading the love a little bit better in order to mitigate potential risk in the future? So those are very, very exciting. I'm just going to have a quick sip of water as I won't go through this. And another interesting aspect of what we're doing is, now that we've amassed many thousands of suppliers, many tens of thousands of sites, and we have survey data, we aggregate this in we normalize the data, and we start to present our own benchmarks. You as a provider or a supplier or a GPO can create your own risk scoring, supplier scorecarding, and supplier risk weightings to the attributes you want. That is fully capable in the system, but we also have one. And it's a very scientific method. I think it first originated maybe out of MIT. And we're looking at transparency, network resiliency, continuity robustness, performance, and supply chain risk maturity. And using that together with all the event data we're capturing, all the macroeconomic or geopolitical or natural hazards of the place, if the financial rating has dropped for this company, we're looking at this, and we are ranking people based on where they are, the green, where the best in class is the blue, and this is where they stand vis-a-vis the average. So this will be available, and what we're hoping is that it would be a standard for providers to use to say, in the RFP process, you can be if you're above a 6, you're fine in the Resilinc system because we trust the science behind it. Or you have to present all this data, all this continuity data to me in the RFP process. So this is a great opportunity here for us to create a standard and drive to transparency, which is, I just was at the IDN Summit last week in Orlando. I'm actually back in Orlando now for the HIDA conference. I don't know if anyone's going to that this week. I'd be happy to meet you. But I lost count of the number of times the providers and the speakers said, we're looking for transparency. We want transparency all around, right? That's not just in supply chain, but supply chain was mentioned ad nauseum as well, and the ability to partner with our suppliers. Come visit us, come see with us, come sit in our operating rooms, come talk to our supply chain people about where these concentrations, where the vulnerabilities exist, where are the potential failure points, work through it. Because providers often don't have the resources to manage this at a macro scale. So they're relying on the suppliers to either give them the full visibility they need for comfort, or to be working with them in collaboration and partnership to make sure that both sides are very comfortable. So what we're trying to do is, of course, here, build an end-to-end connected supply chain, right? And that's fairly used buzzword. And by the way, we do have true artificial intelligence on our product. Yes, we have natural language processing, machine learning, neural networks, naive-Bayes, and we do all of that in our system as well. We have to monitor hundreds and hundreds of millions of news stories and social media to tell you that It wasn't actually an earthquake. It wasn't the San Jose earthquakes, the soccer team that had a published article. So we have a tremendous amount of AI that goes into narrowing what's only applicable to your industry or to your entity. But being able to look upstream and get material flow and the connectivity between all the nodes, whether transportation, warehouse, port, first-tier supplier, second-tier supplier. And what you start to understand here is that a tier 1 is actually a supplier to one of your tier 2s, or to another vendor who is your tier 1 as well. So you have, where is your risk? It's not with the wholesaler or the distributor who you may buy with, it's who they buy from, and then how do they get their goods? So we have the ability to look inside and give that visibility. We then manage through the crisis, a lot of contextual information provided here, a lot of sourcing intelligence going into this. And then we're starting to look at downstream visibility as well. So what does that mean? So if you're a GPO or actually anyone can do this, if you're an IDN and you have a centralized department, you're monitoring what's happening upstream. You're looking at all this crisis management side, but you're also able to see, it's very difficult for you to see here. We can accept the data which says that these products or these parts or these GTINs are used in this hospital, in this oncology department, and potentially even down to the service level. So we now know if something's happening in Alaska over here, we now know exactly what products, what parts, what sites, what suppliers, and what the potential revenue or patient care is at risk, and we can tell you what hospital and what's and what department could be affected by this. So this is where we're driving to, and this is what the board is driving to, and trying to get this visibility, number one, and then drive to the standard and the benchmark. Okay, and that is the HTI. So if I just in recap before I open it up to questions, it's we serve the mission of reducing the number of patient care delays from supply-originated disruptions. And I want to take billions of dollars of waste, resource waste, across the value chain in managing through these. We monitor the FDA sites, the recalls, shortages. We monitor hundreds of thousands of sites for cyber and all sorts of event types that would affect healthcare. And we do that so we can distill the data and communicate that truthful, hopefully, that validated and accurate and timely information. And it's normally within an hour. Within an hour of an event, you will have it on your mobile device telling you exactly what the impact could be to your supply chain. And in fact, the email that we send to you also gets sent back upstream to your supply chain so that they can communicate across the network to say, yes, impact, 2-week recovery time, but we've got inventory which we're going to be sending to you, whatever the notes are in there. So the communication and the collaboration. And once we can achieve that, we're putting all this data into an ecosystem, which, by the way, keeps your data highly confidential and always remains that way, but allows for the sharing ability of that. So if you want to know if Becton Dickinson has a business continuity plan in the system, it may exist. And if it exists, you can use that for a vastly reduced fee that you would have to pay than going to them and managing through that process. And if anyone's done a survey process, you know it is a pain. It's difficult. It's difficult to obtain the data. We've just been doing it for 9-10 years. We've just gotten good at it. And so if it's there, that's great. If the parts exist, and we've loaded good ID and other item masters coming, then we know pretty much the products are in our system, the sites are in our system. There's a lot of visibility data that's already in our system from other suppliers putting it in. we've done our own research on the market, and we've populated the database. And so as more and more come in, more and more is available in the ecosystem to share. Even on top of that, as more and more come on, I personally, the HTI will be investing to go and get, on behalf of industry, more and more transparency data. And that, again, will just keep increasing the amount of availability. And that is very exciting to a lot of providers, because in 24 hours, I can meet a board mandate for visibility. It doesn't mean you've got a resilient supply chain. That's a journey that we will walk you down. But if you want to take your top 300 suppliers, which are probably 80% of your spend, not a proxy for risk, but it's a good number, it's a good way to start, I can be monitoring and allowing you to proactively view the failure points or potential failure points and provide you that visibility in 24 hours. And we've reduced the price significantly because we are expecting to have hundreds and hundreds of IDNs participate, and as well as suppliers, by the way, as well as, of course, the GPOs distributors. But the idea is I can meet a mandate very, very fast, and then we start to understand we need a little bit of data from you about what products you're buying and from whom. Now, typically, that's very available from an ERP system, generally. And then we're looking through our ecosystem, our sphere of knowledge, and we probably have a lot to tell you already. And if we don't, then we can go and acquire that data for you. And remember, the suppliers want to join because they know this is coming, number one. They want to get ahead of it. Number two, they know what you know. They want to know what you know immediately. Number three, they want to improve their benchmark score in here, as well as they want to be able to collaborate with the hospitals and get some visibility into how their products are being used. And we can use some aggregated data in order to give them insights into the downstream world for them. So there's lots of value there, as well as they manage their own supply chain more effectively. So now if the supplier has 2 tiers of data, that means the provider has 3 tiers of data, potential visibility into the system. I say potential, but they have confidence that 3 tiers are being monitored. And that really changes the game, is very disruptive, and really puts the power in the hands of the practitioners of health and the providers of health in order for them to ensure that they don't have to look a patient in the eye and say, I got to push your surgery off another 6 weeks because of a shortage of a generic drug or something that has occurred. All right. Gabrielle, I've spoken my words for the day. That was 400 words a minute with gusts up to 500. So I appreciate everyone listening and love to open up to some questions.
Yes, great. I do have questions that have popped in, so we can start with the first one, which is, what is the cost?
The cost, always the question, right? Well, I do need some information from you. So please give me send me an email for me to get it correct, but to get the my email address is there. I do need to understand how many suppliers you would like to monitor upfront, and also what type of visibility information you're looking for. I would suggest, though, that joining the HTI can be as low as $2,000 a year, and getting visibility into approximately 3,000 sites, which I could literally now deliver that to you in 24 hours, starts at about 5,000, depending on the size of the IDN, and probably goes up to about $8,000 or $9,000 per year for that level. So it's going to be somewhere in that range. Now, Building a resilient supply chain is a slightly different story, but they're fractional costs compared to what this would normally take an entity to do. So now if we want to go and do some surveys, the pricing will go up. However, with the network effect here, we are going to be enable your cost to go down over time and continually go down as more and more data comes on. So it gives you an idea of where you can start. But obviously, if you want to cover 1,000 suppliers with 5 different survey types, that can get fairly expensive. What else do you have, Gabrielle?
Okay, so the next question is, what is the difference between HTI and Resilinc's other product offerings?
Well, actually, there's very little. There's not a huge amount of difference in functionality, with the exception that we are tailoring a lot of dashboards and analytics specifically around healthcare. And that's what the board is helping to drive for me. The idea of being able to monitor your supply chain through the crisis, as well as do the proactive / predictive analysis and do the supplier scorecarding and risk analysis, all that is inherent for all our customers that use it today, and they use it very effectively for that, with a lot of ROI, by the way. The ROI is fairly easily justifiable, and we have a good spreadsheet for that. If you're a manufacturer, that's where we have a lot of data on that. But the difference is that we are really operationalizing and standardizing on how data is delivered, and that's a bit different. So what we're doing now is, because we're a little unique here in healthcare by having such complexity inside of the supply chain, being able to share this information more readily, pour the data in, and us, by the way, the HTI, taking the financial risk of providing you $20 million of data and software for a fraction of the cost, because we believe in the mission and we believe that ultimately there's going to be enough participation that we can start to reinvest back in the process over time. That is a bit different. So the business model is different, and the way we're network sharing and the extent and the operationalizing of it is a little bit different. It's not that that won't be available to other high-tech customers, for example, in the future. It's just that we're doing it with healthcare, and this is the foray for us in using this model.
Okay, great. That's good to know. The next question is, do you have any examples of companies saving money as a result of an event?
Oh, let me think for a second. Yes. I'll take one example of Biogen. And I used that one because it was Hurricane Maria. And we know of a lot of customers where that was very expensive, of course, right? Because not only was it product manufactured there, but they were actually component suppliers to others, to other assembly operations. So it actually knocked out 2 tiers. But Biogen, a couple of years before, had an issue. And it was, again, this one was weather related again. And they got dinged pretty heavily. They lost a lot of money on that. Hurricane took out a key manufacturing operation of their supplier, and they went down for weeks and weeks, and that was tens of millions. Now, they did have the Resilinc system, and they actually integrated it to their GSOC, their security, which was a very, very cool setup with their war room with lots of, it's a guy's delight because they're big screen TVs everywhere. And they were able to acknowledge what was on the island at the time and what components were on the island and what inventories were on, and move that out before anything happened. They did initiate a spot buy of a few $1 million within relative hours of this, and were able to have no disruption. So they literally went from tens of millions a couple of years before to 0. And that's on the manufacturer's side, right? And on the provider side, it's still relatively new, but I can tell you with the Sterigenics side, people were aware, they knew, and they were able to take action sometimes weeks before. And if you've ever done the internal cost analysis of what it takes all your staffing inside to do this, especially if you're using nurses and surgeons sometimes, it could be, we do have some numbers around that too. But generally, we have more ROI stories in our manufacturing, and there are many with GM and Dentsply, another one of our suppliers. Major issues have been resolved leveraging the system that you see.
Those are great examples. The last question here is, you said you monitor for recalls and shortages. Do you also monitor for specific categories and keywords?
Yes, and thousands upon thousands. So we are monitoring FDA and multiple other sites looking for data as it applies to the recall, what the products, who the manufacturers are, and any particular site information that we can extract. So I don't know the actual number, Gabrielle, but I think it's in the realm of like a couple of 100,000 sites, or maybe even higher than that, are being monitored 24/7. And literally hundreds of news stories are coming in that we're having to sift through to make sure that it's contextually correct. So we have a lot of keywords as it pertains to recalls, shortages, M&A, contamination. Oh gosh, I'm running out of, my mind's going blank here. But please note a lot. And in some instances, our clients have actually asked us to monitor for something that's unique to their industry or unique to a category of product that they are producing or selling or using. And we take those and we embed that into our logic as well. So we can actually take, if there's anything specific or special that you're looking at, we can take that and also apply the same algorithms and machine learning on the back end.
All right, wonderful. So I don't see any more questions. So if you have any additional questions, please do not hesitate to reach out. Send them to Graham directly. Once again, his email is graham.dykes@resilinc.com. And if you liked what you heard today, please do contact Graham to sign up. Thank you for joining today's webinar. Have a great day, everyone.
Bye-bye, everyone.